Okay, all right. This is also just a reminder that all of our upcoming seminars and events are always listed on our events calendar on our website, which I will share the link in the chat. Next month, we have our usual virtual monthly Swetland seminar, which will be on November 15th at 9 a.m. Our speaker, Dr. Brandy Phipps, will share about one of her current projects, the Sushi Project. It's a $10 million USDA sustainable agricultural systems project focused on the following goals. One is investigating methods to decrease the cost and environmental impact of nutrient-dense food production. Two, increasing domestic markets for hemp grain and aquaculture to positively impact environmental footprint and equity access. And equity access issues within food production in the US. Three, contributing to the diversity of the agricultural workforce. And four, supporting the food sovereignty and public health efforts of a low-resource minority community. I am also excited to share that we will have our second Nourish and Power networking event on December 6, 2022, which will be hosted at St. Martin de Porres High School. You can scan the QR code or visit our events page to sign up for this event. We are pleased to share that both of our speakers today are Swetland alumni. It's always exciting when we can bring back our colleagues to hear about the exciting work they are doing. First, Dr. Elizabeth Benninger is a postdoctoral research fellow for the CAER Alliance, a research practice partnership with Cleveland State University and Cleveland Metropolitan School Districts, and also the founder and CEO of Healthy Minds, Healthy Communities Consulting. She obtained a master's in psychology from Antioch University, Los Angeles, and a doctoral degree in psychology from the University of Western Cape in Cape Town, South Africa. Her research interests include the study of children's well-being, health disparities, participatory research approaches, and community health promotion. Her work additionally focuses on national and international collaborations with nonprofits and non-governmental organizations, which specifically focus on community-engaged approaches to improving the well-being of children and families. Our second presenter today is Dr. Megan Smith-Sain, who is a research fellow at the Institute of Development Studies in the United Kingdom. She recently graduated from the Department of Anthropology at Case Western Reserve University with a PhD in medical anthropology and has interdisciplinary training with a master's in public health from Columbia University. Her research focuses on social and behavioral factors that shape infectious diseases and epidemics, health equity, and the social determinants of health. She uses mixed methods in her research, including qualitative and participatory action research methods. She works collaboratively with communities, community stakeholders, and local organizations in her work with a focus on translation of research findings to policy and public health practice. Well, we do hope that we see you again soon for a seminar and upcoming events. You can scan the QR code on this screen that you'll be able to visit our Linktree site where you can stay connected to all happenings at the Swetland Center. At this point, I'm going to hand it over to Dr. Smith and Dr. Benninger to share their screen and take it from here. Thank you.
Thank you so much. I'll just share this. Yeah, so thank you so much, and thank you to the Swetland Center for having us. I think this is meaningful for Elizabeth and me, not only because we did train at the Swetland Center, but because we actually met at the Swetland Center, and this kind of kicked off our research collaboration. So it's really nice to be able to come back and have the chance to share this work with you all. So thank you. So today we'll talk about our youth participatory action research, or YPAR, study of young people's experiences during the COVID-19 pandemic and how it has shaped their views of COVID vaccines. And so this study was part of a larger program of research that I mentioned that started at the Swetland Center that engages young people in the Cleveland area to study health equity and well-being. And so we'll talk a little bit about that as well. So we'll share that background. We'll discuss the research aims and key concepts, and then our methods and findings. And we'll also share the kind of significance of this research in relation to wider work on COVID-19 vaccines and youth engagement in the Cleveland area, and also why it's important to kind of understand the wider context of youth experiences, health, and well-being.
So I'll speak a little bit more about our research program here in Cleveland. So it started in 2019 when Meg and I were both working at the Swetland Center, and we were able to get a grant, a pilot award through the Center for Reducing Health Disparities to explore more broadly how young people define their health and well-being and how inequitable neighborhood environments affect that. And so it was looking at neighborhoods in Cleveland that we'll talk about in a minute that have some of the highest health disparities in the region. And so we tried to make those research questions as broad as possible so that we could really allow the youth to focus on the issues within the scope of health and well-being that were most pressing to them from their viewpoint. And then in the middle of that process, there was the pandemic in early 2020, and we started shifting, realizing what a pressing issue it was onto young people's health. We started looking for other resources to be able to explore the impact that the pandemic was having on young people. And Megan had moved to the UK and started doing research there at the time. And so we saw this RFP to basically to try and understand using participatory approaches. Vaccine hesitancy was the term that they were using amongst youth. And so we developed a multi-site study, a cross-national study. So we had samples here in Cleveland and in London to explore this using the same approach as our youth well-being study. And so it kind of branched out from that study. And then so COVID came up naturally as like a huge issue while we were doing that study. And then community violence was the other major pressing issue, and the impact of mass incarceration on young people's well-being. And so we actually were able to secure a third grant to be studying that. So we had these three projects sort of happening simultaneously, but they were all interrelated, and they all were really led and guided by youth in the Cleveland area and by youth priorities. And so I'll have Megan talk a little bit more about youth participatory action research and what that means and looks like.
Thanks, Elizabeth. Yeah, so for those who may be less familiar with the term, youth participatory action research is a form of participatory research that specifically aims at increasing the involvement and engagement of young people in the research process, as well as the action piece, which is kind of working on the social change at a community level usually. And so YPAR really bases its design on kind of improving equality between researchers and young people to allow more of a collaborative co-creation of knowledge. And this involves processes of reflection and kind of touching base and being, gathering youth feedback on the process and kind of iteratively building that into the study design. And then also involving and working very closely with young people as we translate research findings into actions. So in our program across these different projects that Elizabeth talked about, we utilize this YPAR methodology that we've piloted with that first grant and started to hone over the several years in the different projects to kind of more broadly further our understanding of how the environment, the social, cultural, physical environment, how that shapes children's health in the Cleveland area and developing strategies for improving health equity. So this is kind of really premised on the idea that children and youth should be involved in that process from the research stage through to shaping policy and kind of change. So of course, this involves working in partnership with young people, and we've worked with them in kind of different capacities. So we've had some who are just traditional participants who participate in interviews or group discussions. Some have gone on to become our co-researchers, and we always keep those opportunities open. Some of it's kind of self-selection and who's interested or available to do that. Some have served on our youth advisory boards or as interns on our program. And we've also kind of listened and tried to build capacities and skills where possible. For example, in terms of supporting young people to, in their own voices, kind of share findings with policymakers, but we've also worked more widely in terms of supporting career or education advancement, like through just reviewing a CV or a resume or college application essay, or kind of giving advice on careers and things like that. So it can be much more broad. So I'll let Elizabeth talk about your program.
Yeah, and so building off of what Megan said, when we talk about participation and we think about participation, it's definitely can be on a spectrum. So there's varying degrees of participation. And we found that while in the ideal situation, we really maximize the amount of participation of young people where they are fully leading everything and coming up with the questions and really owning the information and leading the stakeholder engagement and things like that. But we realized that actually is not feasible for a lot of young people and not always what they want, and can put a lot of pressure on them, and that they have a lot of conflicting needs and values and things like that as well. And so we created very flexible participatory processes for our young people. And so I think where we strived for that to maximize the participation as best as we could, while also leaving the door open for young people who maybe all that they were able or wanted to give was an interview or answer a survey or things like that. So that was one really important piece. We tried our best to root our research in community needs. And this is also very challenging in the reality of how academic work, how things are funded and incentivized and things like that. Like normally to get funding to do a project, you need a strong research question and a strong research proposal, which is often designed through the researchers' perspectives on what people need and what communities need. And so we also value the need to compensate community members, especially youth, for their time. So this was challenging because how do you compensate people for their time to develop these research questions before you have the funding? So this is why, like with our initial grant, we wrote it to be as broad as possible so that it could leave the space for the youth to really define what health and well-being meant to them and what areas of it were important to them. And we did something similar with the vaccine hesitancy grant. I mean, the RFP was very clear that they wanted us to explore this, but we wrote into our proposal that this was going to be one aspect of what we talk about with the youth, but we also wrote that we wanted to hear more broadly about what they were experiencing during the COVID-19 pandemic and how it was affecting them, whether maybe it was going to be about the vaccine, we didn't know. But we knew that the pandemic was affecting them because that had come up a lot in our work. And so those are different ways that we tried our best to draw upon their experiences and their priorities and things like that. And then the next point of this type of research being slow research, this is also a challenge that anybody doing participatory research will face. It takes time, and for us, we see it as a movement, which is why we've been really fortunate to keep trying to find creative funding streams to keep the movement going. But in academic research, things are funded as projects. And for us, YPAR wasn't just a once-off project, it's an ongoing movement to engage youth voices, to increase their voices, to transform our society and our city to a place that really values their participation in a meaningful way and creates more transformative solutions to support it out of that. So that takes time. It's not going to be achieved in 1 year with a $20,000 pilot award. And just to build the relationships and the trust within communities, which we're going to speak about in our findings also, it takes a lot of time. And so it's not something you can just kind of fly in and say, okay, I need this youth advisory board, and then you're going to have 20 young people saying, okay, I want to do that. And it just happens. It really is a slow moving, long-term vision process. And it also requires adaptability. So we learn as we go, we elicit feedback as we go from our participants who are also our co-researchers and collaborators. And we have to adjust our plans based on the reality of the situation, including not expecting a pandemic when we started this work. So that took a lot of adjustment and a lot of trial and error of like, can we do this through Zoom? Can we meet safely at the rec center? Can we meet under a tree outside? Will the IRB let us do any of that? And then just engaged. We really strive to be a bridge between young people and policymakers in Cleveland. And so sometimes that's allowing young people to present in front of policymakers. Sometimes that's co-developing policy briefs with them. We're going to show you an animation that we developed. So really helping them guide that process. We have youth who are 15, 16 years old who really do not want to go stand in front of a group of adult policymakers in the city, but they would love to help create an animation that we can show to policymakers. So really helping them guide and working with their comfort while also helping develop skills for that. So that's more about our model that we've used.
Thanks. Yeah, so as Elizabeth has said, we started this study at a time when the Omicron wave was kind of kicking off and peaking. So not the best timing for trying to do kind of in-person qualitative work. So we did have to adjust quite a bit. But so we also began this when vaccines were kind of a few months into being rolled out. So this was October 2021. So it had been about, I think, 5 months since young people had been eligible, like 12 years and up in Ohio. So, and at that time, uptake of the vaccine was pretty low. So that's where kind of these questions came up. Vaccination rates have, of course, improved somewhat, but I think our findings and our aims are still kind of relevant for booster doses of the vaccine, as well as youth engagement, as Elizabeth said, more broadly in the city. So our questions didn't just focus on that vaccine piece. We wanted to ask kind of the why, like what was the context of young people's lives, what was going on, what kind of experiences did they see as relevant to their views on COVID vaccines. So we really were asking, like, how did the wider environmental context, specific not only to specific geographies, but also like social location, are these individuals from ethnic minority communities? What are the local histories of that in Cleveland? And so how did that, as well as these wider experiences of systemic racism, structural inequalities, and historical injustice kind of shape responses to COVID vaccines? And then we also wanted to explore the role of mistrust. So how did young people kind of conceptualize mistrust, and what might be the role of that in kind of their responses to COVID vaccines? So these are really about the kind of why questions. Like, we knew the what, we knew that the data on vaccine uptake was lower amongst youth, but then we really wanted to delve into the why from kind of like multiple levels. Around that time as well, there was this wider kind of national project called the Communivax Coalition, which was one of our kind of models for collaboration. That was a partnership between anthropologists, other social scientists, public health, and community organizations and advocates. And they really kind of had already honed in on this need for public health engagement with minority communities who had had these historical experiences, such as Tuskegee, which created that justified sense of mistrust in the medical community and public health. But at the same time, and our study we'll talk about this in our findings. There's also these kind of like everyday current experiences that make people a little bit mistrustful as well. And so, yeah, so these were our project aims. So we've also kind of mentioned this concept of vaccine hesitancy. And so we started at that point. This is kind of our starting point. This is what the grant call was about, is about vaccine hesitancy. So this kind of public health terminology comes from the definition that we used, which is from the WHO's Scientific Advisory Group for Emergencies, which defines hesitancy, in quotes, as kind of a delay in the acceptance or total refusal of vaccines despite the availability of vaccination services. So it's really perceived as a kind of dynamic thing. It's a wide spectrum. It's not just about like taking a vaccine or not taking it. It's quite a wide spectrum, from kind of having doubts about a vaccine to being totally not wanting to take it. So as we'll talk about today as well, we take a little bit of a critical lens on this idea about vaccine hesitancy. A lot of the kind of discourse around this focuses on like misinformation, or people having, quoting, like incorrect information or conspiracy theories, but we looked much more broadly at what else was going on. Like, why are people saying that they don't want to take the vaccine or they don't trust that it's safe? Like, what is kind of the deeper context of those kinds of opinions amongst young people? And we also take a rights-based approach to this, which means that we're looking at like how disparities and how communities engage with health or vaccination are really a consequence of inequities that are derived from kind of the broader structural and social determinants of health. So this kind of helped us in our framing of the study. And we also looked a little bit at vaccine confidence, which is just kind of a related concept, which looks at the belief that like vaccination and vaccination uptake and the providers, private sector, and institutions behind it serve the public's best interests. So people will have confidence if there's that kind of perception that these institutions are working in their best interests. So both vaccine hesitancy and confidence are very variable and very much rooted in kind of local context, local histories, and so on, which was the framing of our study. So we're looking at these things kind of in the context of place conditions. So how place, social relationships, community engagement, how this is really integral to things like vaccination, and how not only the COVID-19 pandemic has affected people, but also how it in turn affects how they view public health policies and the vaccine as well. So we kind of looked at this, these place conditions to kind of look at what was this wider context. And that included also looking at kind of longstanding systemic racism and structural inequalities, which play a fundamental role in this kind of not only differential impact of the COVID-19 pandemic, but in terms of how much people trust in public institutions, including public health, and kind of how that filtered through to attitudes towards vaccines. So we talk about, when we're talking about systemic racism, we use this kind of definition that it's this socially constructed scaffolding, I find that metaphor kind of helpful, that supports and maintains racial discrimination. And so while racism and what it looks like may change over time, it's this scaffolding that's really rooted, that just holds it in place and becomes really difficult to kind of overcome. And then when we're talking about structural inequalities, we're looking at kind of two aspects of this, like how it persists over time, but then also how it's intersectional. So we're not only looking at like inequalities on the basis of income, but race, class, gender, immigration status, and how these kind of intersect to create a specific social position. So these kind of things taken together, what we're talking about when we discuss like the context of vaccine hesitancy and vaccine confidence, if that makes sense. And we're happy to discuss this in more detail as well. over to you.
Yeah, so and an example of how this has been of a place condition and ongoing structural inequalities in Cleveland is redlining. And this is not the only example, and structural inequalities and structural racism have affected various populations of our country that continue to experience the highest health disparities, dating way further back than redlining. But this is one example that occurred through like the 1940s, 50s, and even into the 60s, where neighborhoods were marked as undesirable or redlined, largely based on the populations that lived in the neighborhood. So originally it included various immigrant groups such as Hungarians, Irish, and then African Americans, Latinx populations, and other minority groups. And people from those neighborhoods were denied access to loans to buy houses. They were prohibited from living in areas that were not marked red. And so this created a lot of inequities, especially when it comes to home ownership and wealth, and also investment in those neighborhoods. And so that's one strong example. And so if you go to the next slide, when we map redlining today to other health disparities that we're seeing or other socioeconomic disparities, social disparities, we see the same neighborhoods today continue to experience the highest levels of poverty, the lowest levels of life expectancy. They continue to be segregated racially, and that had a large impact on also health outcomes, that we saw during the pandemic and the level of risks that people were facing. It also had an impact on issues around trust and other things of that nature. And so Megan will speak a little bit more about how these type of structural inequities, yes, many of them are rooted in historical events, but they perpetuate today. They haven't gone away. It's not like this experiment happened and it was wrong and now this doesn't occur anymore. These inequities are perpetuated today in many other ways, and they're systemic, they're embedded in our systems. And so sometimes it makes it difficult for people to acknowledge or to recognize or to see because they've become so normalized.
Yeah, definitely. And one of the things that we noticed, interestingly, was that we saw these similar disparities when we mapped the vaccination data. This is pulled from February 2022 from Cleveland Department of Public Health data, but we looked at kind of the just the raw numbers of uptake amongst youth ages 12 to 18. So you can see in the lighter blue areas are lower levels of vaccination compared to the darker areas, which had higher. So you can see these kind of mapped on disparities that somewhat correspond to the kind of redlining or formerly redlined neighborhoods. So just to note that this is kind of the situation or the map that we were looking at when we conducted our study. So Elizabeth, over to you.
Yeah, so we spoke a bit about our methods. We utilize youth participatory action research from November through March 2022. That was like the core phase of our data collection, I will say, but really we had a youth advisory board in place as we were writing the grant, and that guided us through the process, and actually that we continue to meet with today to form various to help with continued action planning and to help with various forms of dissemination. But the peak of the data collection was between November and March. And so we had 61 young people involved. And we have like a core group of 5 to 10 youth who continue to stay involved in various ways right now. And it included youth ages 12 to 18 in the greater Cleveland area, so spanning into some of the inner ring suburbs as well, such as like Maple Heights. And it included, we did in-depth interviews with young people, we had focus group discussions, we had a youth advisory board, And we also engage, especially with the middle school aged youth. We had a couple groups that were based in the schools. We did drawings and journaling, and really we met with them over a span of about 10 weeks to really engage in the topic and to build trust and to find creative ways of them expressing their feelings and their thoughts around the pandemic. And then we use thematic analysis for the data, which was all qualitative data. And so one of the outcomes that we're going to show at the end is that the Youth Advisory Board decided to do as a dissemination project was to create an animation around their experiences during the pandemic. So you'll see some stills from our animation throughout as we report our findings. And I put those in there because I wanted to show you how the youth did such a great job, like really taking all of these findings together and helping condense it to a 2-minute animation that they felt really captured the essence of what young people were experiencing in Cleveland. But a major thing that came up to help provide context for our study was just the high level of uncertainty and anxiety around the months of remote learning, hybrid schools, and just like that huge educational disruption. So in Cleveland, our schools shut down in March of 2020 and remained closed even without remote learning until September of 2020. And then they remained in a remote format for most of the public schools for another year. This was very different than some of the private schools or schools in the suburban areas. And there was a lot of uncertainty. There was, it was a huge disruption in their social lives. And yeah, so that created a lot of stress for young people. And then here's a quote from one of our participants. Mine was horrible for me. I couldn't comprehend anything. And I felt so stupid. I felt like I was just like the dumbest thing in the world. I was like, I just don't understand. So many people are thriving online and I can't do it. I was a straight A student, 4.0 GPA, never anything less. And when the pandemic hit, I got my first D. So young people experience different degrees of struggle during this time. We heard very similar responses as this participant about just really struggling to adapt to online learning, a lot of it based on mental health challenges that they were having and stress and anxiety, others just because it wasn't an accessible way of learning for them. And then we had some young people that really thrived in the online environment. So we did have some mixed perceptions, but there was a consensus that it was a very stressful transition, and the anxiety of not really knowing when you're going to see your friends again or when things will go back to normal really permeated across our various participants and groups.
Yeah, definitely. Just to build on what Elizabeth has said, so mental health really came up, and we kind of started with these, broader questions of what young people's experiences were like during the pandemic. And so mental health was one thing that came up quite often. So Elizabeth already talked about these kind of restrictions and the influence of local and community level dynamics that really kind of played into young people's mental health. So this was a time of enormous stress. I mean, for everyone, for sure, but young people in general were quite affected by a lot of the pandemic restrictions, which kind of drove a sense of isolation. The school closures affected them in terms of a lot of people felt like they couldn't keep up, which further contributed to what they talked about was a sense of anxiety. And then this was also compounded for students from families that kind of were facing hardship and adversity. They had family members who were maybe essential workers in these kind of vulnerable occupations, or had maybe lost their jobs or were struggling to meet their food and nutritional needs. Others were kind of living in more crowded homes because people had come to move back in with families. So they're living often in multi-generational homes and they just didn't have their own space anymore. So this was like a lot of youth described this as kind of a time of stress, uncertainty, and instability, as well as a lack of clarity of what might happen in the near future. And I think a lot of young people felt like they weren't listened to or didn't have anyone to talk to or any kind of positive outlet for this stress. Youth centers had closed. They couldn't necessarily go outside. The outside neighborhood was maybe not safe either. So this idea that, just go exercise outside wasn't really resonating with a lot of youth, such as the kids that we talked to from Central Neighborhood, where you can't really go outside because of gun violence and safety issues. So while some definitely reported space where they could actually find support, like, for example, through online communities, or they found kind of tools online to help them deal with stress and anxiety or depression. Others reported a much certain worsening of their symptoms, including like the role that isolation played into kind of just making them feel like there was increased hopelessness, and they reported higher levels of symptoms of depression and anxiety. So this really kind of created this feedback loop where they felt isolated, and then this kind of fed back into their school performance and made school an even more stressful experience for several of the young people. So in terms of vaccination, so that was kind of the wider context that young people were experiencing, but how did this play into their views on vaccination? So we saw some kind of general trends in what young people were reporting, and we saw major differences in vaccination uptake based on age, these experiences that I mentioned, as well as family and kind of social context, including parental influence, as well as socioeconomic pressures. So we also noted that those young people who were vaccinated tended to be younger, but to also have these kind of wider circles of influence. So they had parents who were very involved in the decision, or extended family members, siblings, et cetera, who talked about it. They also were more likely to know more people who were vaccinated, whereas the youth who were less likely to be vaccinated tended to kind of have these smaller circles, fewer people that they trusted or listened to. Maybe a parent encouraged them to get vaccinated, maybe not. They also were much less likely to know anyone else who was vaccinated, and they were much less likely to even talk about it with friends, or it wasn't really like a big deal to them. They didn't really seem to discuss it outside of the interview space. There were also just not many polarizing views. A lot of people occupied this kind of middle ground. So we'll talk about these differences between younger youth, these uncertainties that the youth talked about, as well as the older youth. So we'll go through each. Elizabeth?
Yeah, so for a lot of the younger youth, and we started our conversation really speaking more broadly about like health and about trying to get at questions around trust too, of like, what does health mean to you? And often they would identify things like, oh, our hospitals and going to the doctor and things like that. And asking them, what do you do when you get sick? Who do you trust when you get sick? And, my mom, usually the responses would be around things like, oh, my mom and the doctor. And so then when we got into asking more about like the vaccine, if they wanted to share their thoughts on the COVID-19 vaccine, and if that was something that they were open to receiving or that they already received, they tended to not have a strong opinion about it. Like it was like either they did or they didn't, and it was largely because their mother or father took them to get it, or sibling took them, and there were few instances where some of the younger youth felt either strongly for it, and their parents did not want them to have the vaccine, or strongly against it, and their parent had forced them essentially to get the vaccine. So that was really a lot around the discussions with the younger participants, and they did have more of most of the participants who we talked to in that age group were vaccinated. And so then when we would talk about it in like a focus group, we did see some peer influence, because there were a couple kids who weren't vaccinated who were like, I'm not, but then once another youth said they're like, well, I'm going to get it. So it was an interesting dynamic, but it seemed largely driven by the influence of the trusting adults that they had in their lives, and they seem to have a stronger trust as well in like the more traditional medical services, like going to a doctor, and if the doctor says this is good for you, then I just do it kind of mentality.
Yeah, so as Elizabeth mentioned, we kind of had a lot of uncertainties that young people talked about. So whether or not they were vaccinated, a lot of young people felt like they didn't have enough information. They had concerns over safety, but maybe they got it, maybe they didn't. There were concerns over kind of how quickly the vaccines were developed, and we all heard this, right, reported in the media as well, and like about, yeah, these kind of general public discourses around the vaccines, as well as there are also concerns over long-term or potential long-term side effects that the young people didn't really know. And they often said that they wanted to talk to someone about this, but just didn't have anyone to ask. So for older people, how this played out was that, for example, I'm thinking about one young man who saw a couple of videos on TikTok and then decided that that was enough to kind of warn him away from getting vaccinated. He didn't talk to anyone else about it. He didn't speak to a parent about it. He never spoke about it with his friends. It was just, he saw enough information to make him just wary enough to not get vaccinated. And this kind of matched his general worldview and kind of lack of trust in institutions and kind of authority figures in the area. So for older youth, this decision around vaccination was kind of largely accompanied by that process of like hearing some reports or some information on social media, but then trying to make the best decision that they could. And maybe this would involve other people, maybe this wouldn't. And for many, it was just enough to make them question it and question the safety, and this kind of safer option in their words was just to not get vaccinated. As I mentioned earlier, they often had smaller circles of trust. So when you'd ask, is there anyone you can talk to to ask questions about the vaccine, or who do you trust in your circle? They might mention one or two people, like their mom, or a girlfriend or boyfriend, something like that. And then many just did not, not even related to trust or the vaccine, many just didn't prioritize it. A lot of the older youth were working, worried about getting through high school or applying for college, or getting back into sports and doing sports training. So the vaccine wasn't necessarily a high priority for them. And so as this young man said, so he had a lot of kind of really negative experiences with other institutions, like with his school. He had teachers who he just didn't trust or had bad experiences with. And he also had kind of negative past experiences with medical providers in his life. But he said that he really didn't want to get vaccinated because people would say that, he heard some stuff about people saying that they do stuff to people, or you shouldn't take it, might feel funny after. And so he said that was just enough. That was just enough to kind of convince him to not take it. And he's still kind of scared, and he feels like he made the right decision.
And so thinking about this in terms of historical injustice and mistrust, since this was part of our research questions, we know that racism and racial inequities absolutely exist within our neighborhoods of Cleveland, but we also have seen the ways that these are experienced differently and interpreted differently. And so there's not just there's not one way of like experiencing this racism or one type of reaction to it. This is especially true when speaking to young people. So some young people in our study were very clear about the connection between the distrust that they had in the vaccine and in medicine and in many of our institutions, and its relationship between with many historical injustices and abuses, especially on Black communities and medical experimentation and things like that. And others, this was not really something that came up in the conversations, or didn't, as Megan said, didn't really influence their decision making. They were thinking more critically about other things that that made them wary of a new vaccine that was being introduced, or they had, like, another, on the other side of it, they had seen something on TikTok or things like that. So they didn't really speak to it in connection to racism. So just to state that it definitely was experienced in a range and expressed in a range, and it did not always apply to whether or not somebody decided to receive the COVID-19 vaccine. There were many other reasons why young people did or did not get the vaccine outside of just this historical racism piece. And so here's one quote from the participant. I know you probably hear this as an example that the Tuskegee experiment. Has that experiment really had like an impact on my decision? I'm not saying that, like, you know, they're trying to do it again or anything like that, but like, you can see how people are a little iffy on, you know, taking stuff from the government. A lot of people forgot that history, and it's crazy how they're like, I didn't even learn this in school. I learned it on TikTok. I don't understand why they don't teach this. But that's all I really just know about it. I'm already 50-50 on whether I should get it or not. And so that's an example of the type of discourse that we were seeing within our conversations. And also that social media can be very educational for young people as well, and it doesn't always just expose them to misinformation. It can expose them to information that can be helpful in their decision making, and that young people were striving to make the best decision at many times for their health, and there were various issues of where to go to talk to somebody openly about these different questions that they have, and whether or not the best decision for them and their health would be to get this vaccine or not. And so we really strive to validate those concerns and those experiences, and not just write it off as ignorance or misinformation when we had discussions with young people.
So I know we have just 10 minutes left, so I don't know how we should prioritize it to leave time for questions, but I think we can just briefly show you what our kind of ending framework was. So we kind of layered on the use narratives onto the WHO's kind of vaccine hesitancy model. So as you can see, it's really this wide range. So we saw narratives around young people being not interested at one kind of end, or perceiving that it was just, you know, they had enough questions to make them feel like it was just questionable enough to not get it. And you had a lot of people who were in the middle. And then you had quite a few young people who were really adamant they were getting information from the CDC, or they were following the governor's Twitter page or Twitter account and getting updates from there. And they really felt like it was the right and scientifically sound choice to make, and really were very critical of other young people in their lives who they knew hadn't gotten it. But you saw this really wide range of narratives. And we found, as we discussed, that this was kind of patterned by age, social location, experiences, and socioeconomic status as well. But we're happy, we can share links to kind of the reports and as well with a lot more information. Elizabeth, did you want to share the policy recommendations really quickly, and then, or how do you want to?
Yeah, sure. So I guess, you know, we'll share that real quick and show the animation, but I think some of the policy recommendations that we have recognize that vaccine decision-making is complex and an ongoing process. So I think that's really important, and we've spoken to that. Prioritize the mitigation of longstanding health inequities. So the inequities that we saw during the pandemic and the health outcomes were rooted in longstanding health inequities. And so we really, our approach needs to go beyond just a campaign to get as many people vaccinated, and really have them actively involved and respect their decision-making and the complexity behind it, and prioritize those health inequities. And then also engage in listening sessions or in other ways of really trying to understand youth and their experiences. And this is why we wanted to talk to youth about things beyond the vaccine. We really wanted to understand the broader context that was affecting their overall experience in health and well-being during the pandemic, which a vaccine, may be one piece in supporting their health, but it wasn't the only piece that was going to support their health.
Yeah, and just to add on to that, I know we focused on the findings from the Cleveland study, but we heard from young people in London that they were really suspicious as to why people kept talking to them about the vaccine, but then didn't ask them about anything else going on in their lives or didn't really seem to care. And so they felt a little bit suspicious of like, why are you coming to me to talk about a vaccine right now? But, I'm hungry, or I have this problem with, trying to find a job, et cetera. So I think just engaging with that broader context is important. Sorry.
Yeah, and then to partner with cross-sector mental health initiatives to respond to the different experiences of mental health that were coming up in our study, to work with other sectors to create more positive spaces for youth. So really having this much more holistic approach to health promotion beyond that, the prevention of a vaccine. Provide support to trusted mentors, teachers, and parents so that they can have positive conversations with young people and open conversations about their questions and concerns, whether it's about the vaccine or other issues that they're facing. And then, really investing in long-term relationship building and trust with young people. And so I'll briefly show this and then we'll open. It's just 2 minutes and then we have a few minutes left for questions. But so I'll share my screen. Let's see here.
Sorry, and while she's doing that, just to say that we also have Jillian here, who is our excellent graduate research assistant. So thanks for joining, just to credit you for all your great work on the project as well. Couldn't have done it without you.
Absolutely. Yeah, so as one of the outcomes of this ongoing movement of youth engagement, we've created this website called Cleveland YPAR, where we plan to house different information and dissemination materials and things like that. So the youth really led this process of developing this animation and a discussion guide that we've been utilizing in the schools to help create more dialogue around their experiences. And so I'll play this very quickly.
When COVID hit, the world stopped. Family get-togethers weren't the same. School wasn't the same. As kids, we felt isolated. You see, us kids have a lot on our minds these days. We may not have children to care for or bills to pay, but as kids, we still feel stressed. Even before COVID, we already had to deal with the issues like bullying, loneliness, and depression. Even the challenges that come with social media and relationships. But COVID, well, it only made things worse. The news was on blast 24/7. And at the time, it seemed like adults were more concerned with the question, when can kids go back to school, rather than the question, how are the kids doing? Some of the things that gave us joy were pulled right from under us, mostly without our input. Sure, our opinions were sought from time to time, but it often felt shallow, distracted, half-hearted. We didn't feel like we had a voice, but we learned something from all of this. We learned that we need the adults in our lives, parents, administrators, teachers, coaches, to listen. We need those empowered to lift us up, to give us a voice. Adults, it's okay if you don't have all the answers, but take the time to check in with the young people in your lives, not because you have to, but because you want to. Leave the door open for conversation. And even though as kids may need our space from time to time, we'll try to leave the door open too.
So now we have a few minutes for questions. Sorry,
So sorry.
Thank you so much, Megan and Elizabeth. Let's give it up virtual. Yeah, that was a great presentation. We have just a few minutes for questions. I know Darcy put in one question. Darcy, do you want to go ahead and ask it?
Sure, I was just curious, is there like an expiration date to being a YPAR researcher? And just, you know, you guys are young, but you're not teenagers. And so is there how does your age influence your interactions with youth? And I don't know, I was curious about that.
I feel like our age, our youngish age helps make us more accessible to youth, but I was told in this process, like once I hit 30, that I was getting old. I was getting pretty old. But what I've seen with the youth is like the consistency of just showing up and listening and really following through and following up seem to transcend the age, because we've also collaborated with older adults in the community who have been essential in forming these relationships and partnerships, and their characteristics were really just having that that consistent, loving, creating that consistent, loving, respectful, listening space for young people. So I think if we can keep those qualities, hopefully we can continue this work into our older ages.
Awesome.
Yeah.
Thank you. Is there any other question we have just a minute?
I just have one other question. I mean, the video was excellent. How are you using that now with the schools? Like, I feel like that's a really powerful conversation starter.
Yeah,
beyond COVID.
It's been really great. It was helpful that I started a new fellowship in connection with Cleveland Metropolitan School District. And so I've been using it in trainings with social and emotional learning coordinators who are teachers based in all of the schools in Cleveland. And they've been bringing it back to the classroom and sharing it with other teachers in the schools and using it in the counseling centers and the planning centers that they have in the schools. So working to train the teachers and the counselors, and I did some professional development trainings as well. And what's really great is there's a discussion guide that goes with it, and it starts with like acknowledging the experience, but then also moving to the place of like, how are you now? How is this still affecting you now? If it is, what support do you still need? And a lot of that, of course, the mental health effects have really lingered in many ways, like, and it's helped other adults really open up about and recognize the trauma that they're still holding from this, and the way that maybe it's been creating barriers in the classroom, or just to build empathy across groups. Because I think most of us watch this video and can relate to so many pieces of it, regardless of our age or our race or the community that we live in. And so it helps build that empathy and understanding of young people. So that's been the approach so far, and it's been really great to see it utilized in the schools as a tool for creating more dialogue and support.
Awesome.
Yeah,
You're going to
definitely.
take one more question.
Oh, sorry.
Oh, go ahead.
Oh, sorry. I'll just add a quick comment on that. Just to say that as well, we had young people kind of co-author the shorter pieces and reports and like policy briefings that we put out. And I think that was really well received by public health, the public health practitioners kind of in West London. And so that's spurned this kind of youth-led effort that's now turned into kind of a broader project that we are just starting around kind of reducing health disparities and building wider community partnerships, but youth are very much at the center of that. So over here, we've kind of transitioned into like building on the work that the young people and we did, and just broadening it out to address health equity more widely. So yeah, it's
Awesome.
interesting.
We have time. We're going to take just one
Sorry.
last question. Otsino, do you want to go ahead and ask your question? We do have some in the chat, so if you guys want to respond in the chat, that would be great.
Thank you so much. And thank you both for this really great presentation. So in the video, and you guys talked about throughout your seminar, how teens were kind of getting exhausted of like hearing this news and adults talking over them. And something that's come up a lot, especially as the pandemic continues, is will we need COVID vaccines, you know, on an annual basis, on a semi-annual basis? Was that a theme that has come up? Like, I'm imagining teens that were maybe willing to get the vaccine at first, but are now like more hesitant as like they're getting exhausted about having to continually think about this. I just was wondering if that was maybe a theme that has come up.
Yeah, that's a really great question. And from my memory of the data, because of the time frame of it, where we weren't at the point of all these boosters and things like that, it wasn't so prevalent in our discussions. I don't know, Megan, if there's some instances where it was, or it's just the context of timing. So I'm not sure. Yeah. So it would be interesting, you know, it's an area for, and I think many adults are at that point too, right? It's like a lot of the things the youth were saying are very similar to the same concerns and experiences of many adults as well.
All right,
Thank
thank you all for attending. The recording will be available on our websites if you want to check it out again. Thank you, Dr. Smith and Dr. Benninger.
Thank you so much.
Yeah, thank you so much. I'm trying to respond to some of the questions in the chat.
Thank you. And I put a couple of links if you're interested in